Now here's our reporter Laura Windsor with a segment on how improvements in care are saving more infants born with birth defects.
According to the CDC, about 1 in every 33 births, a baby is born with a birth defect. At Chalk Children's Hospital, we had the pleasure of interviewing Dr. Irfan Ahmad, a neonatologist who discusses his specialty and the therapies offered to help these smallest patients.
A birth defect can be of different kinds. It can be internal or external. And internal means that it is a problem in one of the organ systems inside the body. An external defect would be something which would be very visible after the baby is born. Other than structural birth defects, they can also be abnormalities in the enzyme systems inside the body, which help in different endocrine and other important processes inside the body. We work very closely with our obstetrics colleagues, and if they have a patient who is expecting a baby, and in their screening process they have identified certain structural defects. For example, if the baby has a heart defect or has an obstructed intestine, then we get involved. We are able to meet with the families in a perinatal conference along with their obstetricians and talk about the nature of the abnormality and what we can do after the baby is born. Once the mom is admitted in the hospital, we get involved again. We actually attend the birth and make sure we are able to stabilize the baby. On the other hand, there are instances in which during the prenatal screening, everything has looked pretty good. And the baby is born, and quite unexpectedly, they find structural abnormalities, or the baby is not able to breathe, or the baby has a very loud heart murmur. In those instances, our pediatric colleagues give us a call, and we go and assess the baby, and if needed, bring the baby over to the neonatal intensive care unit.
Dr. Ahmad, how early can a baby be successfully delivered?
50, 60 years ago, it would have been unheard of saving a fetus who is born at 24 weeks. In this day and age, we can even try to save little babies as small as 23 to 24 weeks and weighing as little as 400 to 500 grams. Not only do we have ventilators which can provide artificial breathing for the babies, we can also take care of the heart in certain conditions, and we can even place some of the very sick babies on what is called ECMO, which is a bypass machine. So it takes over all the functions of the heart and the lungs and keep the baby alive until we can do repair surgery or whatever the baby needs. It's very, very critical in the initial few minutes when a baby is initially born and is struggling to breathe. At that time, if you have the facilities and you can provide enough oxygen and make the baby breathe, and then lo and behold, the baby totally turns around. And even as a medical student, when I saw that happen, that a baby who appeared dead in a few minutes was totally alive, from deep blue turned totally pink and started crying, I knew this is what I will do the rest of my life.
Not all birth defects can be prevented, but there are things the woman can do before and during pregnancy to increase her chances of having a healthy baby. If you are pregnant or thinking of becoming pregnant, make sure you see your healthcare provider with any questions, concerns, and the proper prenatal care. For the American Health Journal, I'm Laura Windsor.